We have good doctors, we have good hospitals, we have people who deliver care, we have nurses, we have a very skilled healthcare system. What we don't have is the interconnectedness between those places to make sure that we deliver the highest quality care we could. And there was a time 50, 60 years ago where knowing your one doctor and making sure that doctor knew all about you was sufficient. But today, patients are seen by doctors all around the community. Patients are seen in various health systems. And so the infrastructure in the healthcare system has just not evolved to keep up with that. The first component of that has been to have electronic health records within a practice. That is, the doctor interacts with the system and tracks the data in an electronic system. But that's really just been the first step. What we've been missing for a long time, and is just now beginning to come about, is the ability for records to move from one doctor's office to another as the patient moves from one doctor's office to another. And that seems like a simple thing, but if you can imagine banking without the electronic transfer of information or funds, you'd still be going to a teller for everything. The banks would be much smaller, there'd be many fewer transactions going on, and there would be no way for me to really monitor what was going on with my bank. As it stands today, I can do almost everything I need to do with a bank from home, from a web page, from my smartphone. And I'm not suggesting that healthcare get all the way to that point immediately, but certainly we have needed for a long time the ability to move this information around and for providers to have a comprehensive view of what's going on with their patient's health so we can make good decisions and give good advice to patients based on all the available information. And so when I use the term healthcare public utility, I use it because it means some important things that I think should be characteristics of the system. First of all, the public utilities are always there. The water's on, the power is on, the cable is on. They're always there. They're reliable. Secondly, they're predictable from a cost perspective. You know what it's going to cost. And generally speaking, as a public utility, they're not in business to have a big margin of profit. They're in business to deliver the service and cover their costs, and that's exactly the vision we've set forth for MyHealth Access Network, is to be that public utility that's always there, that's available, that's reliable, and is delivering its service, but is not out there to build a huge profit margin or to build an empire, but instead is to help the constituents, that is the patients and the doctors and the hospitals, to have overall better health and a better experience in the healthcare delivery system. So for that reason, I call it a public utility. It sort of sits in a between space between everybody's individual organizations, including patients. And I think the standard we should hold it to is the standard we hold our public utilities to.